Hello everyone, my name is Dr. Forwith with Advanced ENT and Allergy. On this episode I will talk about sinus surgery and ringing in the ears.
If balloon sinuplasty is ruled out and endoscopic sinus surgery is required, what are the risks and recovery?
Balloon sinuplasty is a great procedure, but not everybody is the right person for that procedure. So if your doctor says that you need endoscopic sinus surgery, there are some risks and you should talk specifically with your doctor about those risks. The areas where we're working in sinus surgery are right between the eyes, and so there is a risk to the eyes when we do that surgery, very low, but nonetheless, you should talk to your surgeon about that. There's also the sinuses go right up against the brain at the very front of the skull, and there's some risk involved there with leakage of fluid from the brain and things of that sort. Again, doesn't happen very often, but definitely something you should consider and talk with your surgeon specifically about those risks. As far as recovery is concerned, typically 3 to 7 days is about the right period of time to plan for recovery from sinus surgery. A lot of this depends on how bad you are going in and what kind of specific problems you have. But generally it's a very mild to moderate recovery. Generally, middle of the road pain reliever is sufficient for just about everybody that has sinus disease. Really a great procedure. Not quite like the old days where packing used to make the recovery miserable. These days we don't need to use packing, and it is a much better experience for just about everybody who has to have it.
I had sinus surgery 6 months ago and received relief from my terrible headaches. Is it normal to blow green bloody excess out of your nose daily?
No, that is not normal at all. I'm glad to hear that you have relief from your headaches, but clearly with green drainage and bloody drainage, there's something else going on in those sinuses. More than likely, you're continuing to have infections. The difference is the infections aren't producing a lot of pain because your sinuses are open and can drain well. So that's definitely something you need to come in and talk to your surgeon about. That's something that definitely needs to be evaluated and treated, and you definitely shouldn't have that. That's way out of the usual, so definitely go see your surgeon about that.
Can I ever get rid of high-pitched ringing in my right ear? I believe I got it from an extremely loud fire alarm.
Ringing that's induced by noise trauma can be treated best if we get there early. So seeing your ear, nose, and throat doctor as soon as a noise trauma occurs is always the best route. The earlier we get to see you, the better chance we can have of relieving it and not making it a permanent situation. Now, if it's been there for years, there's probably not a lot that we're going to be able to do about that. Unfortunately, the damage to the ear might be permanent. If you have permanent damage to the ears, one of the side effects is you might have ringing as a result of that as well. So that's something that highly is dependent upon the timing, and definitely something you should talk to your ear, nose, throat doctor about.